Senator Lynn Ruane. Just wait a moment. Are you dealing with it? Oh, yeah, sorry.
Yeah.
Go ahead, proceed. You have 4 minutes. Yeah.
Congratulations on your election to chair. I would also like to thank the graduates of Trinity College for giving me the mandate to be here today, and thank you, Minister, for your time. Just to give you a bit of background, I've spent the last 15 years developing addiction programmes, sitting on local drugs task forces. I've been involved in drug research on drug trends and the changing nature of drug use, and I've also worked directly with those involved in low-level dealing. I was alarmed to read the media last week where amendments were noted that would be changed to the Misuse of Drugs Act that would further criminalise the drug user. How we as legislators respond to the use and sale of drugs illustrates our values. I, along with others, were elected to advocate for progressive drug policy. Criminalising drug users has been proven by international evidence-based research to have failed to address addiction and drug problems. All over the world, societies are recognising that addiction needs to be treated as a public health issue, not a criminal one. If we look at these amendments in light of recent developments towards injecting rooms, it's nonsensical. It's 1 step forward and 2 steps back. For example, the Minister has named Zopiclone as a drug that will be targeted by these amendments. Many of the people selling Zopiclone are selling this to fund their own drug use. People who are addicted to Zopiclone, which is actually a widely used street benzo, will be at risk of resorting to taking other substances that would create further harms to the individual and the community. This also alters trends in drug use, which without adequate resources the services actually can't keep up with. Many who use street benzos can't access treatment for benzo addiction. Many people have suffered benzo fits from trying to detox themselves. This bill does not help this matter, as it potentially forces their removal off the market without matching it with treatment beds and pushes the addict further into harm. I imagine the Minister, in your role with the Department of Health, this would not be your desired outcome. I would like to draw the Minister's attention to studies that clearly demonstrate the need to be progressive with drug policy, not regressive, which these amendments mostly are. The UN Special Assembly on Foreign Policy, socio-economic approaches for addressing drug-related crime and alternative livelihood policies should be fully integrated into overall economic development efforts. Mass incarceration of users and low-level, non-violent pushers does little to suppress and can exacerbate the use of illicit drugs. It may also increase drug market violence. Possession of street benzos and the legality of those puts extra strain on already under-resourced Gardaí and potentially costs the state due to unnecessary imprisonment of low-level dealers. In another study, the International Drug Policy, it states the level of harm, which was a very important sentence for me, it states the level of harm is more important than the size of the market. And this is what these amendments are: harmful. To further criminalise individuals will further alienate them, prevent them from moving on and have prospects, especially with the current spent convictions bill. The success of the Portuguese model has been well documented, and I urge the Minister to explore the evidence for decriminalisation model that includes a person-centred approach to drugs and addiction. I would like to ask the Minister to delay the introduction of these measures to allow for input from all involved stakeholders so policy is evidence-based. Will the Minister commit in the future to evidence-based drug policy that has harm reduction at its foundation rather than contributing to the cycle of criminality? I would also like to ask the Minister how these banned drugs will be scheduled, and can the Minister answer whether the controlling of these substances will be extended to the medical and pharmacy industries, as the oversubscription of these drugs has, in my experience, been much more harmful than the illegal street dealing. I understand that the Minister possibly feels compelled to respond to the incidents in North Inner City, but I hope you will consider that these measures are regressive, potential harm to the user's health, and ultimately will never affect those at the top of the drug trail. Thank you, Minister.
Minister, respond.
Thank you very much, Cearl. I want to thank Senator Ruane and congratulate her on her election to this House. And I take the point very seriously based on your experience that you're making here. But I suppose there's two issues, and I would contend that they're somewhat separate in terms of what I'm trying to do in relation to this situation, but also what government needs to do and must do in relation to a national drug strategy. I want to start with a brief explanation of the existing misuse of drugs legislation. This legislation has two primary purposes. Firstly, it aims to protect the public from dangerous and harmful substances which have no therapeutic or other legitimate use, for example, ecstasy or head shop drugs, by establishing a system of tight control over these. Secondly, the legislation facilitates the safe use of certain controlled drug substances which do have a medical and therapeutic value but which are harmful if misused, such as benzos, such as heroin and cocaine. The misuse of drugs legislation is an important element of the government's arsenal in the fight against drug dealing and trafficking and consequent gangland crime. There is currently a problem in parts of Dublin and elsewhere with the on-street sale of prescription medicines such as benzos. Just to be clear, while it's already an offence under medicines regulations to supply or sell such products without prescription, the Government and An Garda Síochána are of the view that controlling these products under the misuse of drugs legislation will lead to more effective enforcement. Following the recent murders in Dublin's North Inner City, I did instruct my department to expedite the drafting of the Misuse of Drugs Bill, which was originally scheduled for this autumn. I brought the bill to Government yesterday and received agreement to publish it. And I want to be very clear, the Government resolved to giving the Gardaí whatever tools the Gardaí felt they needed to respond to the North Inner City, and this was one of the tools that the Gardaí asked we would put in their toolkit. So this was sought by the Gardaí in terms of a measure to address the issue. So I am responding as part of the whole of government approach to what the Gardaí have asked government to do in terms of addressing the ongoing worrying situation. On-street drug dealers often carry relatively small quantities of drugs on their person, which can make it difficult for the authorities to proceed with the sale or supply charges. Therefore, the bill seeks to make possession of controlled medicines an offence in order for An Garda Síochána to disrupt the activities of dealers and to protect local communities. The bill, if enacted, will provide for the drafting of regulations so that it will not be an offence for legitimate users, such as patients with a prescription and healthcare professionals, to be in possession of controlled drugs. In addition to controlling a number of prescription drugs, the bills will also control a number of substances which the EU or the UN have identified as harmful and open to misuse. These include substances in the N-bomb family of drugs, which were implicated in the tragic incident in Cork earlier this year, in which one individual died and 5 others were hospitalised. The bill will also control Clockwork Orange, a psychoactive substance which is being abused in the border counties and elsewhere in this country. In my view, this legislation is necessary and is appropriate. It is part of the suite of measures to assist in tackling crime and protecting public health. I intend to bring forward, very importantly, a second misuse of drugs bill later this year, which will provide for the establishment of supervised injecting facilities for chronic drug users. I want to reaffirm the government's commitment to that. This is a commitment in the programme for government. I want to acknowledge the work done by Senator O'Riordan in his time as Minister for the National Drug Strategy. My colleague, Catherine Byrne TD, the now Minister of State with responsibility for the National Drug Strategy, is currently developing a new drug strategy, and I understand in that context consideration is given to the establishment of a group which would consider alternative approaches to dealing with simple possession offences. There will be public consultation on the drug strategy in the coming months, and senators and others will have an opportunity to contribute in this process. And I know Minister Byrne would welcome an opportunity to benefit from your own knowledge and expertise in this area, Senator Ruane. In the meantime, though, I would ask for the cooperation of the House in enacting this legislation as just a piece of the jigsaw that we have been asked to put in place by An Garda Síochána, but very clearly making the point that this piece of legislation is not my response, is not the government's response, is not the new national drug strategy. That is a piece of work that will be done, will be undertaken. We will see a second misuse of drugs bill this year in the autumn, and we will see the publication of a new national drug strategy, which will be an action-based strategy to deal with the larger issues, I suppose, that the Senator has legitimately raised, and that will be published this year.
Thank you.
I suppose I'd just like to reiterate the focus is on possession, which again mostly targets people who will be selling for their own use. Just to refer to N-bomb and Clockwork Orange, if you looked further into them cases, polydrug use is usually actually the issue there more so than just N-bomb. So a lot of the deaths that have happened recently have been due to a toxic mix of alcohol, other drugs and this substance. So it's not been proven that it's this substance alone. So again, just to reiterate that the programme for government committed to a health approach to addiction. To know that I feel these amendments are regressive and retrograde in that respect, and they don't actually reach the intended target in terms of high-level dealers. And actually, it does serves to further criminalise the most vulnerable in this society. Thank you.
Briefly, Minister.
To note the Senator's points and accept your bona fides on this issue, hope that you'll accept mine as well, that the commitment in the programme for government in terms of a health-based approach to addiction is very much a commitment we intend to deliver on. I intend to prove that to you and others through the second misuse of drugs bill later this year and the new national drug strategy, but also from my perspective to see when An Garda Síochána are asking government to give them a range of tools to deal with a very specific problem in the North Inner City, that I feel obligated to act in that regard, and that's why I'm bringing forward this piece of legislation, which I hope to have in this House before the summer recess.
Thank you, Minister. That concludes the commencement debate, so the House stands suspended now till 11:30.